Hello, this is Malik Jupiter. I'm going to give you an overview of the skeletal system, specifically the axial division of the skeletal system. Okay, so the skeleton is going to be divided into two sections, the axial skeleton and the appendicular skeleton. Of course, there are going to be 206 separate bones in the body, whereas the axial skeleton consists of 80 of those bones, and it's going to be composed of the bones along that central axis of the body. And then we have the appendicular skeleton, that's going to consist of the other 126 bones. The axial skeleton is going to consist of the skull, the vertebral column, and the thoracic cage, right? And that's going to, of course, be like the skull bones. We're going to have the auditory ossicles, the hyoid bone, the vertebral column, and the thoracic cage, like I mentioned. The appendicular skeleton, that's going to consist of limbs, pectoral girdle, and the bones within the pelvic girdle. So these right here are the axial skeleton bones right here. We see the skull and associated bones, the thoracic cage and the vertebral column, which we'll get into in just a second. So there are many functions that the axial skeleton will, serve and provide. They include, of course, forming a framework that supports and protects organs in that ventral body cavities. It helps to house sense or special sense organs for taste, smell, hearing, balance, and sight. It provides an extensive surface area for the attachment of muscles that adjust the positions of the head, the neck, the trunk, and perform respiratory movements. It also stabilizes or position structures of the appendicular skeleton, and it also functions in the production of blood cells by that red marrow found in the portions of the vertebrae, sternum, and ribs. So the cranium is going to consist of the face, right? Or the skull is going to consist of the face and the cranium, right? The face is going to be 14 individual bones. The cranium is going to be 8 individual bones, and we also have some associated bones that's going to consist of 7, right? And we'll look at these in the numbers right here. Looking at the skull, so we have, looking from left to right, we have the face. It's going to consist of the maxillae, the palatine bones, the nasal bones, inferior nasal conchi, the zygomatic bones, the lacrimal bones. We're going to have the vomer and the mandible, right? For the cranium, we're going to have the occipital bone, the parietal bones, frontal bone, temporal bones, the sphenoid, and the ethmoid. You also have the hyoid bone. That's going to be in that skull region, as well as the auditory ossicles. We're going to have 6 of them. And yes, there's 206 bones in the body, but we want to remember that we're a symmetrical organism, right? So what you see on one side is what you're going to see like on the other side for the most part, right? For example, the auditory ossicles, right? It's 6 of them, so it's 3 in each ear, right? And notice how it's like some of them are like one bone, like the vomer, the mandible, the occipital bone, the sphenoid, the ethmoid bone, even that frontal bone. They're typically going to be in like the middle of the body too. And like these other bones, they're going to be like on the outside of the body, like more lateral. Okay. Moving further, we have sutures, right? So there are the boundaries between skull bones, right? The boundaries between skull bones are going to be these immovable joints called sutures, and they're going to be made up of dense fibrous connective tissue. Okay, you have the lambdoid suture. That's going to be the suture between the occipital bone, right? That bone in the back, posterior, right? That's going to be the suture between the occipital bone and the 2 parietal bones, and we can notice the 2 parietal bones are going to be on the most superior surface of the skull. You have the sagittal suture, right? Think of that mid-sagittal cut. That sagittal suture is going to cut like in the middle, right? That's going to be between the 2 parietal bones. We have the coronal suture, right? Think of that coronal cut, right? That coronal suture is going to be the suture between the frontal bone, right? More anterior bone, and the 2 parietal bones, okay? When we're looking at the squamous suture, you can see on the side right there, the squamous suture is between the temporal bone and the parietal bone. Okay, going to have this squamous suture that's going to be on opposite sides of the head, right? We also have the frontal nasal suture, which I'll show you in just a second. And this is going to be the suture between the nasal bones and the frontal bone. Okay, and of course these sutures and associated bones, they're going to compose up the calvaria or the cranium, right? And you can see here that's highlighted the different sutures. Can't really see the sagittal suture because that's going to be like in the middle of the top of the head, more the superior portion of the head. But we can see the coronal, squamous, lambdoid, and that frontal nasal suture. That's going to be right there too. Okay, it's going to be right above that nasal bone. So starting with the bones of the cranium, right? We're going to start at the back. We're going to start on the posterior side of the body, the back, which is going to be that occipital bone, right? The occipital bone. That's going to contribute to the posterior, lateral, and inferior surfaces of the cranium, right? With that inferior surface of the occipital bone is going to contain that large opening, that foramen magnum, okay? That foramen magnum. And so that's where we're going to be able to connect the cranial cavity with the spinal cavity. That's going to be enclosed by that vertebral column. Okay. We have that occipital condyles, and they're going to be on the inferior portion of the skull and the inferior portion of that occipital bone. This is going to be where the skull actually articulates with the first cervical vertebrae. Okay. We have, on the posterior, we have the external surface of the occipital bone, and it bears a number of prominent ridges. And the external occipital crest will extend posteriorly from that foramen magnum, ending in a small midline bump, and that's going to be called the external occipital protuberance. We have two horizontal ridges that will intersect at the crest. Those are going to be the inferior and superior nuchal lines, and these are the lines that mark the attachment of muscles and ligaments that stabilize the joints between the first vertebrae in the skull at that occipital condyles, and it balances the weight of the head over the vertebrae of the neck. Okay. We also have the occipital bone will form parts of the walls of the large jugular foramen, right? That's where those internal jugular veins will pass through this foramen to drain venous blood from the brain. We have the hypoglossal canals. They're going to begin at the lateral base of each occipital condyle, just superior to the condyles. And these hypoglossal nerves, right, those cranial nerves that control the tongue and muscles, will pass through these canals. Okay. And here you can see that large foramen magnum right there, and we can see also the occipital condyles, the hypoglossal canals where those hypoglossal nerves are going to go through. We see the jugular foramen. That's where those jugular veins are going to pour from the brain, right? Drain the brain. Okay. Going more superior, we have the parietal bones. These are going to be paired bones. Okay. So there's going to be two of these bones. They're going to contribute to the superior and the lateral surface of the cranium. They're going to form a major part of the cranium, as you can see, right? The external surface of each parietal bone is going to bear a pair of low ridges, the superior and the inferior temporal lines. And these lines mark the attachment of the temporalis muscle. And that's going to be a large muscle that closes the mouth. Okay, and the smooth parietal surface superior to those lines is going to be called the parietal eminence. Okay, and that's going to be the smooth surface from the superior temporal line to that sagittal suture area. Those words are tough, right? And here you can see the parietal bone right there, and you can also see the superior and the temporal, the superior and the inferior temporal lines right there as well. Going more anterior, of course, we have the frontal bone. That's going to form the forehead and the roof of the orbit, so those eye sockets, right? So during development, the bones of the cranium form through the fusion of separate centers of ossification. And at birth, the fusion have not been completed. So at this time, there are two frontal bones that articulate along that frontal suture. Right, and so although the suture usually disappears by age 8 with the fusion of these bones, the frontal bone of the adult often retains traces of that suture line. Okay. So the frontal suture, or what remains of it, runs down that center of the frontal eminence of that frontal bone, as you can see. So the convex anterior surface of the frontal bone is called the squamous part, or the forehead, and the lateral surfaces contain the anterior continuations of that superior temporal lines. The frontal part of the frontal bone ends at that supraorbital margins that mark the superior limits of the orbits, right, at the eyes right there. Okay, and you can see the orbital parts of the frontal bone is going to form the roughly horizontal roof of each orbit. Okay. But again, the frontal bone is going to be basically your forehead area. As we can see right here, the frontal bone in that yellow goldish color is going to be in the anterior portion of the skull. We have the temporal bones. Right? These are going to be parrot bones, right? They're going to contribute to the lateral and inferior walls of the cranium and the zygomatic arches of the cheek. Okay. So they form the articulations with the mandible, and they're going to protect those sense organs of the inner ear, okay, for hearing and balance. You have the convex surfaces of the temporal bones just inferior to each parietal bone. That's going to form an extensive area for the attachment of muscles that close the jaw, and that's going to be able to move the head. So the temporal bones articulate with the zygomatic, parietal, and occipital bones, and with the sphenoid and mandible. Okay. So each temporal bone have a squamous, tympanic, and petrous parts. Right? So the squamous part of the temporal bone is the lateral surface bordering that squamous suture. Okay. We have the inferior margin of the squamous part, and that's going to be formed by that prominent zygomatic process. Okay. And this curves laterally to meet the temporal process of the zygomatic bone. And together, these processes will form that zygomatic arch, or else that cheekbone. Okay, that cheekbone right here. That's in the blue that you can see. Okay? And you can see that attachment right there, that zygomatic arch between that temporal bone and that zygomatic bone. So inferior to the base of the zygomatic process, the temporal bone articulates with the mandible, okay? And so there's a depression called the mandibular fossa, right? Fossa depression, and an elevated articular tubercle mark this site, okay? So immediately posterior and lateral to the mandibular fossa is going to be that tympanic part of the temporal bones, right? And that's going to surround the external acoustic meatus, which is the external auditory canal, right? And this passage will end at the delicate tympanic membranes, also known as the eardrums. So the petrous part, right? This is going to be the most massive part of the temporal bones, right? And it's going to surround and protect the sense organs of the hearing and balance. So lateral surface, we're going to have a bulge just posterior and inferior to the external acoustic meatus. And that's going to be called the mastoid process. And you can kind of tap on that behind your ear, right? That bone that's going to be behind your ear. And it provides an attachment site for muscles that rotate or extend the head. Okay, and you can say this, the large portion of this temporal bone is going to be the petrous part. Okay, and it's going to be surrounding that, those sense organs for hearing and balance. So here, we have those auditory ossicles that's going to be within that ear canal, right? Or they can be found within that tympanic cavity. right? And those auditory ossicles are going to be those small, tiny ear bones, okay? We also have the sphenoid, right? We have the sphenoid. So the sphenoid, or the sphenoidal bone, right, will articulate with every other cranial bone and extend from one side to the other side across the floor of that cranium. Okay? Although it's relatively large, much of the sphenoid is hidden by the more superficial bones. So the sphenoid acts as a bridge uniting the cranial and facial bones. It articulates with the frontal, occipital, parietal, ethmoid, and temporal bones of the cranium, and it also articulates with the palatine, zygomatic bones, maxilla, and vomer of the facial complex. Okay? So the sphenoid also acts as a brace, strengthening the sides of the skull. So a prominent central depression between the wings cradles the pituitary gland below the brain. And so this recess is going to be called that hypophyseal fossa. And that bony enclosure, you can see it's going to be, if I go here, it's going to be within that sella turcica, okay, the bottom left image and the top left image. That's where your pituitary gland is going to be housed at, okay, within that sella turcica, okay. We have the ethmoid bone, okay. The ethmoid or ethmoidal bone, right, that's going to be an irregular shaped bone that forms part of the orbital wall, the anterior medial floor of the cranium, and the roof of the nasal cavity. It's also going to be part of the nasal septum, too. So the ethmoid bone has three parts. It has the cribriform plate, has the ethmoidal labyrinth, and the perpendicular plate. The superior surface of the ethmoid contains the cribriform plate, right? This is going to be an area that's perforated. Excuse me. Right? So the top is going to be that, the cribriform plate, right? And this is going to be an area that's perforated by the cribriform foramina, right? So these openings will allow passage of the branches of the olfactory nerves, which will provide the sense of smell. There's a prominent ridge called the crista galla, or galli, that you can see, right? And that separates the right and left sides of the cribriform plate. The ethmoidal labyrinth is going to be dominated by the superior nasal conchae, okay, and the middle nasal conchae, and we can see it best seen right there. So the ethmoidal labyrinth is going to be an interconnected network of ethmoidal air cells, right? These air cells are continuous with the air cells found in the inferior portion of the frontal bone, right? And the ethmoidal air cells also open into the nasal cavity on each side, okay? So again, we see this cribriform plate right here. Area is going to have those holes, those foramina, for the passage of those olfactory nerves. And we have that crista galli, that's going to be that prominent ridge that separates the right and left sides of the cribriform plate. Again, that ethmoidal labyrinth is going to be dominated by the superior nasal conchae, interconnected network of those ethmoidal air cells, which is going to be continuous to the nasal cavity on each side. And of course, then we have the nasal conchae, right? The nasal conchae are thin scrolls of bone that project into the nasal cavity on either side of the perpendicular plate. Right? And the nasal conchae, it breaks up the airflow, creating swirls, which is going to slow the air movement, thereby providing additional time for warming, humidification, and dust removal before it reaches the delicate portions of the respiratory tract. Right? And we also have that perpendicular plate that's going to form parts of the nasal septum. It's going to be a partition that also includes the vomer and a piece of the hyaline cartilage. As we can see that as it hangs down, that perpendicular plate. So we have cranial fossae. And so we can see the contours of the cranium closely follow the shape of the brain, right? So proceeding from anterior to posterior, the floor of the cranium is not horizontal, so it descends in 2 steps, right? And we can see in this image the cranial floor at each level forms a curving depression, and that curving depression is going to be known as cranial fossae, okay, or fossa. The frontal bone, the ethmoid, and the lesser wings of that sphenoid is going to form the anterior cranial fossa, which is going to cradle the frontal lobes of the cerebral hemisphere. The middle cranial fossa is going to extend from the internal nares, right, to the petrous part of the temporal bone, and the sphenoid, temporal, and parietal bones form this fossa, which cradles the temporal lobes of the cerebral hemisphere, and also the diaphyllon, and the anterior portion of the brainstem. And then we have that much more inferior posterior cranial fossa as well, which is going to extend from the petrous parts of the temporal bone to the posterior surface of the skull. And that posterior fossa is formed primarily by the occipital bone, with contributions from the temporal and the parietal bones. Okay. And you can just see these depressions that's going to be in the skull, okay, or in the cranium. So we have bones in the face, okay. The facial bones are going to be those paired maxilla, palatine bones, nasal bones, inferior nasal conchae, zygomatic bones, and lacrimal bones. And we have single bones, 2 single bones, the vomer and the mandible. So there's going to be 2 maxillary bones, okay. And we have 2 palatine bones. The palatine bones are going to be like these L-shaped bones, and they're going to make up the roof of the mouth posterior to the palatine process of the maxilla. And those large, so the maxilla is going to be a left and a right maxilla, or maxillary bones, and they're going to be the largest facial bones, and together they're going to form the upper jaw, okay. The maxilla articulates with other facial bones except the mandible, okay. And we have those large maxillary sinuses in that medial view, and it's going to be these are going to be the largest sinuses in the skull, but that's going to be on the maxillary bones, okay. The bones of the face, we're going to look at the nasal bones and the inferior nasal conchae, right? So there's going to be 2 nasal bones, and they're going to articulate with the frontal bone. We have the inferior nasal conchae, and we have 1 on each side of the nasal septum, and they're going to be attached to the lateral wall of the nasal cavity. Okay. We have the zygomatic bones and the lacrimal bones. There's going to be 2 of these, 2 of each of these, right? So, as we noted earlier, though, the temporal process of the zygomatic bone is going to articulate with the zygomatic process of the temporal bone to form that zygomatic arch. So we have a articulation, right? These zygomatic bones will articulate with the zygomatic process of that temporal bone, right? And as you can see, like the pink going to the blue, that's that articulation right there. We have the lacrimal bones. These are those small bones inside the nose area. That's going to be red on this image. They're going to be found in the medial portion of the orbits of the eye, right? And they're going to have the lacrimal grooves that's going to lead to that nasal lacrimal canals, right? And these are going to be the smallest bones in the face, those lacrimal bones. We have the vomer, which is going to be just 1 bone. As we can see, it forms that inferior portion of that nasal septum. It's going to be based on the floor of the nasal cavity, and it articulates with both the maxilla and the palatine bones along that midline. And you can see how it's right under that ethmoid, just inferior to that ethmoid bone, and superior to the maxilla. Okay. And we have one mandible, right? The mandible is going to form the entire lower jaw, right? That mandibular body is going to support the teeth, and we have the coronoid process. And this is where the temporalis muscle will insert onto the mandible, and this is going to be one of the strongest muscles involved in closing the mouth, right? But again, the mandible is going to be that other bone that's going to form the lower jaw, and that's going to help support the teeth. Okay. We have the orbital complex. Okay. So the orbits are these bony recesses that enclose and protect the eyes. Okay. So in addition to the eye, each orbit also contains a lacrimal gland, adipose tissue, muscles that move the eye, blood vessels, and nerves. Okay. It's going to be formed from the frontal bone that makes the roof of the orbit, that maxilla bone that forms the floor of the orbit, right? So many bones are going to be in process, articulating, coming together to make these orbits. You have the lacrimal and the ethmoid that's going to form the medial wall of the orbit, and the sphenoid bone is going to form the posterior wall of the orbit, whereas the zygomatic bone is going to form that lateral wall, that outside wall of the orbit. Okay. We have the nasal complex, right? So the nasal complex is going to include the bones and cartilages that enclose the nasal cavities and the paranasal sinuses. And those paranasal sinuses are air sacs that are connected to the nasal cavities, right? So the nasal complex extends from the external nares to the internal nares. Okay. So for the paranasal sinuses, right, the frontal bone, the sphenoid, the ethmoid, and the maxilla contain these paranasal sinuses. Okay, and again, these are going to be air-filled chambers that act as extensions of and open into the nasal cavities. Okay, these sinuses, they lighten the skull bones and they produce mucus and resonate during sound production. Okay. And last but not least of the skull and the associated bones, we have the hyoid bone. This hyoid bone lies inferior to the skull, and it's going to be suspended by the stylohyoid ligaments. So the hyoid bone is not in direct contact with any other bone in the skeleton. The body of the hyoid serves as a base for several muscles concerned with movement of the tongue and the larynx. The entire complex is quite mobile, and you can see that it has these greater horns, right, which help support the larynx and serve as the base for the muscles that move the tongue. But specifically, again, this bone is not going to be, articulating with any other bones, right? It's going to be suspended by that stylohyoid ligaments. Okay, and again, it serves, even in its mobility, extremely mobile, right? It serves as points for muscle and ligament attachments. Okay, so it's kind of like just like floating there, basically. So when we're looking at the skulls of infants, children, and adults, right? Many different centers of ossification are involved in the formation of the skull, but as development proceeds, fusion of the centers produce a smaller number of composite bones. So at birth, fusion has not been completed, and there are a number of sphenoid and temporal elements, right? 2 frontal bones, and you have 4 occipital bones. So the skull organizes around the developing brain, and as the time of birth approaches, the brain enlarges rapidly. So although the bones of the skull are also growing, they fail to keep pace. And at birth, areas of fibrous connective tissue connect the cranial bones. These connections are quite flexible, and the skull can be distorted without damage. So such distortion normally occurs during delivery and eases the passage of the infant along the birth canal. So in the largest fibrous regions between the cranial bones, they're going to be known as fontanelles. You have the anterior fontanelle, right? That's going to be the largest. It lies at the intersection of the frontal, sagittal, and coronal sutures. You have the posterior fontanelle. and that's going to be at the junction between the lambdoid and the sagittal sutures. The sphenoidal fontanelles are at the junctions between the squamous sutures and the coronal sutures. And then you have the mastoid fontanelles. They're going to be at the junctions between the squamous sutures and the lambdoid sutures. So the most important growth in the skull, it occurs before age 5, and at the time the brain stops growing and the cranial sutures develop. So as a result, when compared to the the skull of when compared with the skull as a whole, right, the cranium of a young child is relatively larger than that of an adult. Okay. So when we're looking at the vertebral column, the adult vertebral column consists of 26 bones. That's going to be including 24 vertebrae and the sacrum and the coccyx. The vertebrae provides a column of support. It bears the weight of the head, the neck, and the trunk, and ultimately transferring that weight to the appendicular skeleton of the lower limbs. They also provide protection to the spinal cord, providing a passageway for spinal nerves that begin or end at the spinal cord, and help maintain an upright body posture, as in sitting or standing. Right? So we can see here the 24 vertebrae, 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae. We have that sacrum, which is going to be composed of 5 fused vertebrae, and that coccyx, which is going to be composed of 3 to 5 fused vertebrae, which we'll look into. Right. So again, to continue with the functions of the vertebral column. Right. It encloses and protects the spinal cord again, supports the skull, supports the weight of the head, neck, and trunk, and it transfers the weight to the lower limbs. It also helps in maintaining upright body posture, right, or the position of the body. The vertebral column is going to be divided into regions, right? So it's divided into regions, as we can see. Cervical, thoracic, lumbar, sacral. Okay. And again, if we're beginning at the skull, right, and going more inferiorly, we have the cervical, thoracic, lumbar, and sacral, and coccygeal. Each region of the vertebral column have different functions, and as a result, the vertebrae within each region have anatomical specializations that allow for these functional differences. In addition, the vertebrae located at the junction between 2 regions of the vertebral column will share some anatomical characteristics of the region above and the region below. So 7 cervical vertebrae constitute the neck and extend inferiorly to the trunk. The first cervical vertebrae forms a pair of joints or articulations with the occipital condyles of the skull, and the 7th cervical vertebrae articulates with the first thoracic vertebrae. There are 12 thoracic vertebrae that's going to form the mid-back region, and each articulates with 1 or more pairs of ribs. The 12th thoracic vertebrae will articulate with the first lumbar vertebrae. And there are 5 lumbar vertebrae that will form the lower back, and the 5th one will articulate with the sacrum, which in turn is going to articulate with the coccyx. Okay. And we can see that the spinal curves, the vertebral column does not form a straight and rigid structure, right? As we can see the side view, right? It shows those 4 spinal curves, that cervical curve, that thoracic curve, that lumbar curve, and that sacral curve. And these curves, along with muscle attachment to various vertebral processes, they're going to help maintain balance. Okay. So the developing infant, they're going to lack balance. You can see the differences in their spinal curvatures, right? So they lack proper curvature, and they also lack muscle coordination. You can see as the fetus grows into the newborn, it's getting more curve, right? And as you get older and older, you develop a more spinal curvature. So when we're looking at the vertebral anatomy, right? Vertebra, singular, vertebrae, plural, of course, right? So anteriorly, each vertebra has a relatively thick, spherical to oval body from which a vertebral arch will extend posteriorly. So you can see this vertebral arch, and that arch is going to extend posteriorly. These vertebrae, they're going to support the weight along the axis of the body. We can see an anterior view of them, or rather a superior view of them, I should say, in the image. And so vertebral body is going to be separated from another vertebral body by a pad of cartilage, and that's going to be called that intervertebral disc. Okay, so each vertebra is going to articulate with neighboring vertebra, but again, they're going to be separated by that intervertebral cartilage, that disc right there. Okay. So looking at the vertebral arch, right? The vertebral arch will form the lateral and posterior margins of the vertebral foramen, right? That's going to surround a portion of the spinal cord. The vertebral arch has a floor, that's going to be the posterior surface of the body, has walls, which are going to be known as the pedicles, okay? And it has a roof, the laminae. The pedicles, right, arise along the posterior and lateral margins of the body. The laminae, right, is going to be on either side, extending dorsally and medially to complete the roof. And from the fusion of the laminae, we're going to have a spinous process that's going to project dorsally and often caudally from the midline, so in the back, middle, going towards down, right? And these processes can be seen and felt through the skin of the back. That's why you can feel your spinal cord, right? You're feeling that spinous process. We also have transverse processes that's going to project laterally or dorsolaterally on both sides from the point where the laminae joins the pedicles. And these processes are sites of muscle attachment. And they also articulate with the ribs too. We have a condition such as spina bifida, and that's going to be a malformation of the structures making up the vertebral arch. And that's where the vertebral arch fails to close completely, and you can see that image in the top. Right? So looking at the vertebral articulation, so the inferior articular process of one vertebrae articulate with the superior articular process of the more caudal vertebrae, so the one underneath it. So each articular process has a polished surface called an articular facet, that you can see. The superior processes have articular facets on their dorsal surfaces, whereas the inferior processes articulate along their ventral surfaces. So the vertebral arches of the vertebral column together form the vertebral canal, right? A space that encloses the spinal cord. However, the spinal cord is not completely encased in bone, right? And so that's where the vertebral bodies are separated by those intervertebral discs. And there's going to be gaps termed the intervertebral foramina. And that's going to be between the pedicles of successive vertebrae. And these intervertebral foramina, they're going to permit the passage of nerves running to or from the enclosed spinal cord. Okay. When we're looking at the vertebral column, right, there's we number the vertebrae. We have the cervical region, right, all the way up to 7, so 7 cervical vertebrae. We have thoracic region, right, that's going to be like in the thorax of the body. It's going to be 12 thoracic vertebrae. And we have lumbar, that's going to be on the lower back, right? That's going to have 5 vertebrae. And then we end off with the sacral and the coccygeal more caudally to those superior vertebrae. Okay. So when we're looking at the cervical vertebrae, the 7 cervical vertebrae are the smallest of the vertebrae. They extend from the occipital bone of the skull to the thorax. And so first, second, and 7th cervical vertebrae, they possess unique characteristics and are considered to be atypical, right, cervical vertebrae, or special cervical vertebrae, while the 3rd through the 6th display similar characteristics and are considered to be typical cervical vertebrae. Okay. So the cervical vertebrae will support only the weight of the head. So the cervical or the vertebral bodies can be relatively small and light. And as you continue more caudally along the vertebral column, the loading increases and the vertebral bodies gradually enlarge. So in a typical cervical vertebrae, the typical ones like C3 to C6, the spinous process is relatively stumpy, usually shorter than the diameter of the vertebral foramen, and the tip of each process, other than C7, will bear a prominent notch, right? And that notched spinous process is going to be described as a bifidus, or a bifid, I should say, right? And laterally, the transverse processes, they're going to be fused to the costal processes, as you can see in the bottom image, right? And those costal processes, that's going to originate near the ventrolateral portions of the body. So costal, it just refers to a rib, and these processes represent the fused remnants of cervical ribs, right? And so the costal and transverse processes encircle prominent round transverse foramina. Okay, these passageways will protect the vertebral arteries and vertebral veins, and these are going to be important blood vessels that supplies the brain. So when we're looking at the 2 cervical vertebrae, we have C1 is going to be the atlas, and C2 is the axis. So specifically C1, the atlas, right? It articulates with the occipital condyles of the skull, right? And it holds up the head. Right? It holds up the head. And so it's named after Atlas, a figure in Greek mythology who held up the world. Right? So the articulation between the occipital condyles and the atlas is a joint that permits nodding, or basically being able to say yes. Right? But it also prevents twisting. Okay? However, the axis, right? So during development, the body of the atlas fuses to the body of the 2nd cervical vertebrae. That's going to be the axis. And we can see that fusion right here in the bottom image. Right, so this fusion creates the prominent dens of the axis. However, there is no intervertebral disc between the atlas and the axis. So a transverse ligament will bind the dens to the inner surface of the atlas, and that's going to be forming a pivot for rotation of the atlas and the skull relative to that rest of the vertebral column. So the axis allows you to rotate. So this does permit rotation, right? Turning the head from side to side. You know, basically when you say no, when you shake your head no from side to side, that's what this vertebrae does for you. Okay. So important muscles controlling the position of the head and neck attached to the especially robust spinous process of this axis right there. So in a child, the fusion between the dens and the axis is incomplete, and impacts or severe shaking can cause dislocation of the dens and severe damage to the spinal cord. And even in adults, a blow to the base of the skull can equally be dangerous, because a dislocation of the axis and atlas, that joint, a dislocation of that joint can force the dens into the base of the brain, and of course you can have fatal results. All right. So looking at C7, right, the vertebral prominence C7. It has a long, slender spinous process that ends in a broad tubercle, right, that can be felt beneath the skin at the base of the neck. So you can kind of feel that, kind of pokes out in like thinner people or even people with more adipose. You can still feel it when you press in, right? So the vertebra, you can see the interface between the cervical curve, which is going to arch anteriorly, and the thoracic curve, which is going to arch posteriorly. You know, and whiplash is one of those conditions where you have a sudden motion of the head resulting in that vertebral damage. It's like too much force, quick force, right, to the head, and it can be damaging to that vertebral column, specifically in that cervical area. Going more inferiorly, we have the the thoracic vertebrae, right? There are 12 thoracic vertebrae. So a typical thoracic vertebrae has a distinctive heart-shaped body that is going to be more massive than the cervical vertebrae. The round vertebral foramen is relatively smaller, and the long, slender spinous process projects posterior caudally, like meaning in the back, more down. The spinous processes of T10, T11, and T12 increasingly resemble those of the lumbar series as the transition between the thoracic and the lumbar curvatures approaches. And so each thoracic vertebrae articulates with ribs along the dorsolateral surfaces of the body. So thoracic vertebrae T1 to T8 have superior and inferior costal facets as they articulate with two pairs of ribs, and vertebrae T9 to T12 have only a single costal facet on each side. The transverse processes of these vertebrae T1 to T10 are relatively thick, and their anterolateral surfaces contain transverse costal facets for articulation with the tubercles of ribs. And so thus ribs 1 through 10 contact with vertebrae at 2 points, at a costal facet and at a transverse costal facet. And this dual articulation with the ribs limit the mobility of that thoracic vertebrae. Okay. We have the lumbar vertebrae. There's going to be 5 of these, right? These are going to be the largest of the vertebrae. So the body of the typical lumbar vertebrae is going to be thicker than that of the thoracic vertebra, and the superior and inferior surfaces are oval rather than heart-shaped, and there is no articular facets on either the body or the transverse processes. That vertebral foramen is also going to be triangular too. Some of the image got cut off. Looking at the sacral region of the sacrum consists of the fused components of 5 sacral vertebrae. These vertebrae begin fusing shortly after puberty and are usually completely fused between ages 25 and 30. Once this fusion is complete, prominent transverse lines will mark the former boundaries of individual vertebrae, and this composite structure protects reproductive, digestive, and excretory organs, and via paired articulations, it will attach the axial skeleton to the pelvic girdle of the appendicular skeleton. And so there we have that connection between the axial skeleton and the appendicular skeleton here at that sacral region. And of course we have the coccyx, right? The small coccyx will consist of 3 to 5, most often 4, coccygeal vertebrae that usually begin fusing by age 26. Okay, so the coccyx provide an attachment site for a number of ligaments and for a muscle that constricts the anal opening. Okay. So the first 2 coccygeal vertebrae have transverse processes and unfused vertebral arches, and the prominent laminae of the first coccygeal vertebra are known as the coccygeal coronia or corneum. they curve to meet the corneuma of the sacrum. Okay. We have that meet between those two, the sacrum and the coccyx. When we're looking at the thoracic cage, right, so the skeleton of the chest, or the thoracic cage, consists of the thoracic vertebrae, the ribs, and the sternum. The ribs and the sternum form the rib cage, and they support the walls of the thoracic cavity. Okay, and so the thoracic cage serves two functions. Right, it protects the heart, lungs, thymus, and other structures in the thoracic cavity. And it also serves as an attachment point for muscles involved in the respiration, right? Involved in positioning of the vertebral column and movements of the pectoral girdle and the upper limbs. Okay. So looking at the ribs, right? Ribs are going to be these elongated, curved, flattened bones that originate on or between the thoracic vertebrae. And end in the walls of the thoracic cavity. There are going to be 12 pairs of ribs. The first 7 pairs are called true ribs or vertebral sternal ribs. And at the anterior body wall, so at the anterior body wall of the true ribs are going to be connected to the sternum by separate cartilages. These are going to be called costal cartilages. And beginning with the first rib, the vertebral sternal ribs gradually increase in length and in the radius of their curvature. So ribs 8 through 10, they're going to be called false ribs or vertebral chondral ribs because they do not attach directly to the sternum. And so the costal cartilages of the ribs 8 to 10, they fuse together before reaching the sternum. The last 2 pair of ribs are sometimes called floating ribs, as you can see in this anterior view on the right, because they have no connections to the sternum. And this is just another view of it, of the actual sternum. Right? You can see the true ribs being 1 through 7. And the false ribs being 8 through 10. And then in the back, you have those ribs. This just gives you an anterior view. Okay. But we say true ribs are 1 through 7, false ribs 8 through 10, with those last 2 being floating. Okay. Again, there's 12 pairs of ribs. Each rib will articulate with a thoracic vertebra, right? Looking at it, you can see the head, neck, and body of the rib, right? So the head of each rib articulates with the body of the thoracic vertebra or between the adjacent vertebral bodies. After a short neck, the tubercle projects dorsally, and the inferior portion of the tubercle contains an articular facet that contacts the transverse processes of thoracic vertebrae T1 to T11. And when the ribs articulates between adjacent vertebrae, the articular surfaces is divided into the superior and the inferior articular facets by the interarticular crest. Okay. And we have the sternum, right? And this, in the adult sternum, right, it's going to be a flat bone that forms in the anterior midline of the thoracic wall. And the sternum has 3 components. You have the broad triangular manubrium, right? The manubrium, that's going to articulate with the clavicles or your collarbone. Okay. It's going to articulate with the clavicle or the collarbones of the appendicular skeleton and the costal cartilages of the first pair of ribs. The manubrium is the widest and most superior portion of the sternum. You have that jugular knot arch that's going to be in that region, as the shallow indentation on the superior surface of the manubrium is going to be located between the clavicular articulation. You have the tongue-shaped body that's going to attach to the inferior surface of the manubrium and extend caudally along the midline. And so individual costal cartilages from ribs 2 through 7 are attached to this portion of the sternum, and the rib pairs 8 to 10 are also attached to the body, but by a single pair of cartilages shared by rib 7, as you can see right there. The xiphoid process is going to be the smallest part of the sternum. It's going to be attached to the inferior surface of the body, and the muscular diaphragm and the rectus abdominis muscle will attach here at the xiphoid process. And that xiphoid process is also one of the parts that's one of the bones that's easily broken, especially when you're doing CPR. That's why it's important to have proper placement when doing it. Right? That's just an overview of the axial skeleton. Of course, again, going over bones of the skull, vertebral column, and the thoracic cage. Okay.